You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know about getting well and staying well. With us we have clinical compounding pharmacist Mort Farina. Mort, thanks for coming on the show.
My pleasure.
Always a pleasure. I think you were about the second or third person ever on my show. It was a long time ago, about 8 years ago.
It was a long time ago.
And I've learned a lot from you over the years. So now, clinical compounding pharmacist, what is that?
It's the pharmacist that talks to the physician.
Okay.
The doctor tells the pharmacist about the patient's problem. The physician and the pharmacist create a new formulation. The pharmacist figures out the right dosage and how to prepare it, and then goes over the medications with the patient and possibly would add some other suggestions.
Now, in the Coachella Valley, I mean, you've developed a reputation. You have, I think, 5 pharmacists.
That's correct.
There, it's a huge center. You're a major compounding center. But you get a crowd of people that it seems that want to go natural or holistic or bioidentical hormones or the supplement crowd. So what kind of people go in there? And
Yeah, that's an interesting question, because we have parents bringing their children and parents bringing their grandparents and their great-grandparents. So there's no set type of, what it is that...
Looks like a classroom now, by the way.
It is kind of a classroom. We have many areas where the pharmacists sit and talk to patients. Sometimes our pharmacist might talk to a patient for 15, 20 minutes, but usually it's about a half hour, an hour, sometimes 2 hours. Depends on what's the situation and what's required. Our pharmacists are told that they can spend as much time as required to help people and make their suggestions.
That's unusual, isn't it? I mean, you don't see that with a pharmacy.
I'm not aware of any other pharmacist that does that.
Okay, now your pharmacy, you work together with local medical doctors. Would you say you work with local alternative medical doctors, functional medicine doctors, complementary doctors, but you work together with medical doctors?
That's correct.
And you help with the doctors taking people off medications in some cases. Is that correct?
Many doctors will send the patient to us when they can't quite figure out what's the problem.
Okay.
And that's the most fun for us, because when a patient comes to us and they're on 15, 18 medications and they have a clear diagnosis, for us it's usually very simple to figure out what the problem is and how to fix it.
15, 17 medications. Is that common, by the way? Are
Yes.
there a lot of people in the desert that are on over 10 medications?
Unfortunately, the answer is yes.
Like thousands?
I don't have that answer, but we have patients every day coming in on many, it's called polypharmacy.
What does that mean?
Taking many prescriptions.
Many prescriptions.
And sometimes when you take the patients off the medications, they get better.
So most of the problems, I mean, as your take, as a pharmacist, you're in a unique position, that a lot of the drugs or the medications that they're taking, they're causing these side effects that are really at the root cause of a lot of their problems?
Yeah, well, that's called, they have a name for it. It's called iatrogenic disease. It's called doctor or drug-induced disease. And if you watch a television commercial, all they talk about is the side effects on these medications. So if you're taking a statin drug and all of a sudden you lose your memory, or you have muscle pain, or you have a liver problem, those are common side effects. And now if you're
But these medications work, though, because some people get in a vicious cycle. They're on the medications. They love to get off. I don't think there's one person that you could talk to that's on 10 medications that wouldn't like to get off of them. So are you saying, though, that with the help of the medical doctors you work with, that they can be weaned off and still get the same results?
Well, usually the problem is they're not going to one physician. So with the world of specialty today, doctors are very hesitant to take patients off medications that another doctor put them on. So patients may be on a medication for years that the patient needed for when they went on the medication. Now, what's really interesting, when I started pharmacy, the average prescription was usually for 4 days, 7 days, 10 days, maybe 14 days.
Is that right?
You didn't go on a medication forever and ever and ever. That was a vision and a dream by the drug companies to have patients go on medications, stay on medications, so they can do more business.
You believe that? I mean, their intentions can't be that.
No, their intentions absolutely are not that. But if you go to a physician, the physician may be getting on an HMO with less than $10 for a visit, and then they have to do 10 minutes worth of paperwork.
Okay.
Well, let me ask you, how long the Harvard study showed that the average physician takes 18 seconds before they decide what's wrong with the patient and what prescription they're going to give.
Well, oftentimes they don't have the luxury, if they're not a sole practitioner, to spend a lot of time with their patients. But I guess the main message is your pharmacy. I mean, do you consider it a holistic pharmacy? I know it's clinical compounding pharmacy, but is it a holistic approach? I mean, you're doing things like bioidentical hormones, you're doing thermography, and let's talk a little bit about the different services you're offering.
We do thermography. Most people don't know what thermography is, even though it's been approved by the FDA in this country since 1982.
What is it?
These are heat pictures that you take, and you can take it just of the breast. It is probably the fastest way to show if a patient is developing breast cancer.
Is there science behind it?
Oh,
Studies behind
absolutely.
it?
It's used.
Is it accepted in the mainstream?
Absolutely. It's used. It's a screening device, so it shows cancer early.
Earlier than a mammogram?
Well, mammogram takes 8 to 10 years for breast cancer to show up. And what they're doing, they're taking your breast, they're squeezing it, they're putting a rad of radiation in the breast. And if you've been on estrogen, a lot of times these women have dense breasts or fibrocystic breasts, and mammograms don't work.
But mammograms do catch early cancers and save a lot of people's lives every year.
Not early cancers. They do catch cancer. Thermography will catch early cancer.
They could catch a stage 1,
and
can't
so will ultrasound.
Okay.
What that is, it's a screening device because it catches it so quickly. And the only reason I got into mammography, a patient of mine who was supposed to adopt a child in Russia, when she went to Russia to pick up the child, they did a complete physical on her and her husband, and with thermography, they found a lump in her breast. She went back to the United States, they did a lumpectomy, then went back and picked up her child. And that was the motivation for me to get a machine in, train our staff, and we have a radiologist that actually reads the thermographies.
Now you're also doing bone density testing? Is that right?
Yeah, we have a machine that's an amazing machine. It does the spine, the hip, the forearm, and also checks the whole vertebra. We take a picture of the vertebra, and it shows vertebral fractures, and it shows crushed vertebra, and then it'll show you lean body mass. So it's amazing the results.
Insurance covers this?
Some insurance is covered, but what we've done is we've set the price so low that it's pretty easy for anybody to get.
And a lot of people are coming in for things like this.
Well,
because you're a pharmacy.
Well,
so I don't think of it, even though it doesn't look like a typical pharmacy.
But the thing
you have a
is,
lot of people going in there for
osteoporosis did not exist before the 1990s as a disease.
Is that right? Before 1990?
Yeah. So when you do the right things, you can stop the loss of bone loss. And since the body builds 30% brand new bone, the trabecular bone, every year, it's pretty easy to rebuild new bone. You just build more bone than you lose. Hello? Okay. Not a big deal.
Is you the kind of pharmacy, you have the kind of pharmacy, I mean, somebody watching out there in the Coachella Valley, okay? And a lot of people don't like to go to the doctor. They don't want to make the appointment. They don't want to do this. They could walk into your pharmacy, bring in their meds, and say, what do you think? How can I get off these? What are some alternatives? How can I wean myself off? And then you'll work with their medical doctor or a medical doctor to do that? I mean, is that part of your service?
Well, also, we usually ask them to bring lab tests, to bring vitamins, supplements, everything they're taking. So if we're going to make a suggestion or a recommendation, we want to make something that's intelligent.
And you guys go to all the conferences, I've been told, like the anti-aging conferences, you go to all the different meetings.
We try to.
As much as you can.
Right.
But is this your role, though? I guess I'm confused. I mean, can a pharmacist look at blood work and give recommendations?
We have a number of doctors that know of our work, and they're very receptive. Other doctors, especially out of the area, who are not receptive, we call them, and then we send documentation.
Okay.
So when I had a physician that wanted to put a woman on estrogen alone and take her off the progesterone, we sent that doctor 34 pages of documentation about apoptosis and progesterone, and that progesterone causes cancer cell death, and estradiol shuts off the cancer cell death.
Apoptosis, that's the cancer death. What is that?
Cancer cell death.
Okay, cancer cell death.
Yeah, so when somebody has breast cancer, that's what you're hoping for, is to try to naturally kill the cancer cells.